Good afternoon, everyone, and welcome to our Delaware Valley Veterans Consortium Town Hall meeting. My name is Hank Gillen. I am a board member at the Delaware Valley Veterans Consortium, and it's my pleasure to welcome you. This is the latest in a series of town halls in which we explore topical and time-sensitive issues outside our normal quarterly meeting cycle. It's great having everyone here, and I hope your spring has been progressing well. This session, as you would have just been informed, is being recorded, and that recording will be available on our website, which is dvvc.org. The presentation slides will also be available at our website. DVVC is Southeastern Pennsylvania's Community Veteran Engagement Board, whose mission it is to unite military and veteran service organizations and advocates who share common goals to build programmatic capacity and increase services to clients under the umbrella of regional collaboration. DVVC town halls are designed to address topical issues of the moment. And while a lot of us know something about the PACT Act, there's some new information on eligibility that we think is critical for you to know as you deal with the veteran populations in your area as veteran serving organizations. Through our partnership with VA, we have a speaker from our VISN who will update us on the latest changes to the PACT Act and how it will affect you if you are a veteran, and how it will affect the veterans you deal with on a daily basis. As the program progresses, if you have questions for our speaker, then we would request that you put them in the Q&A, and we'll be able to direct those to Jackie when her presentation is over. At this point, I'll introduce our guest speaker. Our speaker today is Jacqueline Hinker. Jacqueline Hinker is a highly accomplished and purposeful professional with a profound connection to the military community. As the daughter of a Korean War combat veteran and Purple Heart recipient, and also the spouse to an Iraq War combat veteran, she brings a unique perspective and a deep understanding of the challenges faced by those who have served. She has navigated the VA healthcare system as a family member for decades. As the proud parent of an airman, she also focuses her attention on educating and supporting families of those who have served and continue to serve. With a career dedicated to serving veterans and their families, Jackie has made significant contributions as a veterans community outreach specialist at the Wilmington VA Medical Center in Delaware. From April 2017 to July 2023, she played a pivotal role in planning and organizing community and educational events for the Public Affairs Office. Her efforts were instrumental in creating impactful presentations that not only enhanced VA service education, but also facilitated access to crucial programs, motivating veterans to enroll in vital services. Her work with New Jersey National Guard leadership has led to monthly physical health assessments engagement, medical hold unit outreach, monthly drill enrollment, and education on the 177th Fighter Wing. These outreach efforts have led to thousands of engagements and connections to VA healthcare, mental health care, and service-connected claims filing opportunities. In recognition of her outstanding contributions in leadership, Jackie transitioned to the role of the VISN 4 Public Affairs Outreach Program Manager, Eastern Market, in July of 2023, where she continues to make a positive impact on the lives of veterans and their families. In this role, she oversees public affairs and outreach initiatives, managing programs that aim to effectively communicate the VA's mission and services with public affairs officers and collateral outreach personnel at the 5 VA medical centers. The Eastern Market encompasses the Wilmington VA Medical Center, Philadelphia VA Medical Center, Coatesville VAMC, Lebanon VAMC, and the Wilkes-Barre VAMC. In addition to her professional accomplishments, Jackie takes pride in her roles as a wife, mother, grandmother, and friend. Her personal and professional life reflects a dedication to service, advocacy, and fostering a strong community bond for the well-being of veterans and their families. Jackie, we thank you for taking time out to join us and explain some of the significant changes to the PACT Act.
Well, I thank you very much for the introduction. Greatly appreciated. Absolutely, I am 100% veteran assistance and family assistance, 24 hours a day, 7 days a week. It is a wonderful gift to be able to have this opportunity to work for an organization that cares for a specific population, especially those who've served in the United States military. So I am very happy every day that I know that at the end of the day, I've helped somebody or educated somebody or connected them to a service that they didn't realize they were eligible for. So very honored to be in the position that I'm in. And I'm very grateful for this opportunity to present this to you. I know you've probably heard a lot about PACT Act, read a lot about PACT Act. We're updated when PACT Act was first signed into law into 2022, but these significant changes have been coming with a lot of questions. So I want to try and make sure we can cover down on any questions that y'all may have. If you have a question, you want to throw it in the chat, or if you want to come off mute, I have no problem with that. I prefer people ask the question when they have it versus maybe jot it down and forget to ask it later. So without further ado, I'll get right into it. And I will say I did not create this. This slide presentation that you're looking at came directly from VA Central Office. So it is the most up-to-date, updated in March. So any future updates, I will obviously alert the DVVC as soon as I get them. You can change the slide. So this training, these are just some of the things that I'm going to be going over. Many of you may be familiar with some of the aspects of the PACT Act, but there's new information that's come to light is about the expansion that just happened on March 5th. So you can just jump ahead. Oh, they can't unmute themselves. I saw that in the chat. That's fine. Throw it in the chat. That sounds lovely. Thank you. You can go to the next slide. All right. So we've expanded healthcare eligibilities now that are looking at different things we'll talk about in a little bit, but location in support of active duty training, inactive duty training, there's a lot of things that go along with that. But what's most important is making sure that we are connecting veterans to us for toxic exposure screening. As you all know, the toxic exposure screening, or maybe you all don't know, but the toxic exposure screening offers us an opportunity for a baseline to find out where somebody was, what they may have been exposed to. It is literally a 5 to 10 minute discussion. But out of that discussion can come some results that we really need to know about being proactive in people's care. We want to be more proactive instead of reactive. And being able to do that toxic exposure screening really helps not just us to care for that one veteran, but also in the research for caring for others who may have the same type of illness that a veteran may present with. It's definitely going to strengthen our research. As you can tell, when the PACT Act was signed into law, we had 20 plus presumptive illnesses based on exposure to airborne particulates, AKA burn pits, and things of that nature. Many, many more, but that was just one of those many. So the research is critically important. We've had so many claims that have been filed based on potential exposure and current illness diagnosis. So the VA that we'll get into that in a little bit too. But if you're receiving email from VA, you're going to see that this is an ebb and flow and it just continues to change. And we may see more presumptive illnesses born out of PACT Act. So it's what I like to call the VA is an ebb and flow. So what wasn't presumptive before may become presumptive in the future. So for veterans who have enrolled for VA healthcare and have been denied for one reason or another, maybe it was because they didn't have a service-connected disability rating. Maybe it was because of their income. They had the minimum duty requirements, but they were over the national income threshold. Then that would be another reason for somebody to reach out and try again. We don't know everybody's time in service. So it's not a one and done with VA. That is enrolling for VA healthcare or filing a disability claim. And go ahead, you can change the slide. Again, PACT Act, toxic exposed veterans becoming eligible for VA care. It was supposed to be done in increments. And between our current time frame and the year 2032. However, on March 5th, that changed. It eliminated the phased approach. So 3 new cohorts of veterans became eligible to enroll for VA healthcare. You can change the slide, please. Oh, can you just go back for 1 second? The most important thing I want you to read on this slide is that veterans must first meet the minimum active duty service and discharge requirements to qualify for VA healthcare under PACT Act authorities. So this is where we're getting a little bit of confusion in the veteran service organizations and with our VSOs who are filing the claims or having people enroll for VA healthcare. Veterans must first meet the minimum active duty service and discharge requirements, even under the PACT Act authorities. So keep that in mind as we move forward. Next slide, please. Okay, so veterans who participated in a toxic risk exposure activity known as a TARA, because we love our acronyms, this has been defined by law while serving on active duty for training, or in active duty. Now I'm saying that, and I'm reminding you of what we just read on the previous slide. So in active duty training, if you are somebody who served in the United States military, however, you've served after September 7th, 1980, and you do not have 24 months consecutive active duty service, the minimum that is the minimum duty requirement for eligibility for VA healthcare. If you do not have that, then we're going to need to connect you with a veteran service officer, someone from the VBA, an accredited veteran service officer, because you're going to need to file a claim if you have a diagnosis of something that could have been related to toxic exposure. So we really need to make that perfectly clear. Active duty for training, that's one thing. So if somebody is in the Army, in the Air Force, in the Marines, the likelihood of them having the 24 months active duty service is there. But for somebody who served in the National Guard, that is going to be different. But having said that, if somebody in the National Guard has had a deployment that makes them eligible for VA healthcare, because there's enhanced eligibility for Guard and Reserve based on Title 10 deployment, then that inactive duty TARA would count for them. But again, they would have to have that Title 10 deployment. So here's where some of the things, this all still stands from 2022. So we just want to make sure that you understand when this was signed into law. Veterans who were assigned to a duty station, including the airspace above certain locations. So these were the locations that you've previously heard about. Some of them have been added. So you have Bahrain, Iraq, Kuwait, Oman, Qatar, Saudi Arabia, Somalia, and the UAE, the United Arab Emirates. So that's very important for that timeline of veteran. On or after September 11, 2001, and some of the things that are noticeable to some veterans are places like Uzbekistan that wasn't recognized previously that's being recognized now. So Afghanistan, Djibouti, Egypt, Jordan, Syria, Lebanon, Yemen, and Uzbekistan. So please bear that in mind. The other thing that was added was veterans who were deployed in support of a mission. So in support of Enduring Freedom, Iraqi Freedom, Operation Freedom Sentinel, Operation New Dawn, Operation Inherent Resolve, and the Resolute Support Mission. So that's something that you want to keep in mind too when you're talking to the veterans that you are engaging with. Next slide, please. Okay, so when we're talking about TARA, and I will let you know that on March 5th, I don't know if you all know that the enrollment form has changed. If you're using the older enrollment form, if you are working with veterans and you are enrolling them for VA healthcare, or at least helping them fill out their documentation, and you have an older form, it won't reflect the exposures and the locations like the new one does. So I would encourage you to go on the va.gov website and download the new 1010 Easy enrollment form as of March of 2024. So in paragraph form, on the application, it gives you different locations and potential exposures, and you click the box if the veteran feels that they've had an exposure to any one of the things. So air pollutants, burn pits, sand and dust particulates, oil well fires, sulfur fires. There's chemicals, the herbicides and pesticides, depleted uranium, occupational hazards such as industrial solvents, asbestos, lead paints, chemical agents, radiation, nuclear weapons. You can read all this for yourself because you will have this slide presentation, but you can see that this has opened up a lot of different exposures that were not recognized previously. Are there any questions in the chat at this point in time that I need to address? I don't see, nope, don't see any.
I don't see any. There,
Okay.
if you'd like, Jackie, there is one in the Q&A
Okay.
already asking about veterans with other than honorable discharges. Is that the discharge characterization you were talking about on the first slide?
I only was really talking on the first slide about having the minimum duty requirement of 24 months active duty service. However, honorable discharge is critically important. There is there's been new word about the OTHs, the other than honorables, and certain discharges that would be eligible for VA healthcare. And I would highly encourage veterans to speak with an accredited veteran service officer for a status upgrade. But right now, we're still looking at honorable in that block. If somebody comes to you and they are other than honorable or they have a general under honorable conditions, I would still have them fill out the 1010 easy enrollment form and let's send it to eligibility. With the new legislation, and I'm not prepared to talk about that today, but that could be on another day. There is a new way to connect to VA healthcare with an other than honorable. But again, that status upgrade is really, really important. So if you have questions on how to do that, again, I would encourage you to speak with an accredited veteran service officer that can assist in working on getting that status upgrade. If you want more information on all of this, as far as the Terra is concerned and the potential exposures, of course, you can find it at the website that you can see right down here, publichealth.va.gov, or you can go on the va.gov website at any time. There's literally a banner as soon as you jump on va.gov that says, what does PACT Act mean for me? You can click on that and that's going to help you guide you to a lot of different answers or different, I call them little plus box, little pluses. Click on all the pluses that mean something for you, and the drop down will explain in further detail. Next slide, please. Thank you. So Vietnam era veterans who had once maybe discounted themselves because they weren't active duty boots on the ground or weren't recognized by the Veterans Benefits Administration because they weren't active duty boots on the ground in Vietnam. PACT Act has changed that. So for veterans who served in Thailand, Laos, Guam, American Samoa, or off the territorial waters, Johnson Atoll, or a ship that was called there between January 1 in 1972 and September 30th, 1977. Again, these are all things that are critically important. A lot of veterans who had applied for disability with something that appeared or could diagnosis that could have been correlated to Agent Orange were denied based on the fact that they were not active duty boots on the ground in Vietnam. But this change is very important to many, many veterans. So we're very pleased to see this. If you know somebody that served Vietnam era that is not connected to VA healthcare, I would highly encourage that you just let them know. Fill out the new 1010 easy enrollment form. That is right on the va.gov website. You can enroll online or go to your closest VA clinic or medical center. We have the forms there. You can even print it out at home, fill it out, take it to one of our closest VA medical centers and submit it there to their eligibility office. Either way, we want everybody to go ahead and fill out that application, even if you've done it before and were denied. Things have changed drastically due to the PACT Act. Next slide, please. Okay, here we are talking about the minimum active duty requirements. So I want you guys to definitely be aware. So in general, veterans must have served 24 months of continuous active duty service or the full period for which they were called or ordered to active duty. So a Title 10 deployment. Case in point, I will just give you, a National Guard deployment, recent Air Guard 177th just came back. There's about 400 veterans because of that Title 10 deployment are now eligible for VA healthcare. They're eligible for VA healthcare. However, they're also going to be looking at now getting a toxic exposure screening. By law, VA now requires us to do a toxic exposure screening, like I discussed in the beginning of the presentation. This toxic exposure screening is critically important, but they're also going to look at what their job is in the military, what they've been exposed to. I mean, if they're Air Guard, maybe they've been doused in jet fuel. If they're Army National Guard, maybe they've come in contact because they've been somewhere where they were breathing in a lot of dust, sandstorms, things of that nature, burn pits. So it's really important that not only are we getting our National Guard and Reserve members enrolled in VA healthcare after that Title 10 deployment, but getting their toxic exposure screenings is going to be very important too if they feel that they've had an exposure. And again, nobody knows anybody else's time in service unless they're articulating that to you. So just meeting anybody who says that they've served in the United States military, it's always great to connect them to that enrollment form because you just don't know. You don't know whether somebody served during a specific time, what they could have been exposed to, what their income is, whether or not they're going to be eligible. So it's just that encouragement to get them connected. There were some exceptions to minimum active duty service requirements and early out for a qualifying reason, like a hardship or a medical discharge. Veteran was discharged because of a disability that was aggravated or made worse during active duty, or the veteran served prior to the 1980s. So prior to the 1980s, that 24-month active duty requirement, the continuous active duty requirement was not there. You can go to the next slide, please. Okay, applying for healthcare is easy. We just talked about it. It can be done online. That will be sent to the Health Eligibility Center in Atlanta. You will receive a letter or a booklet in the mail, or the veteran will receive a letter or a booklet in the mail. You can also call the toll-free hotline and speak with somebody there. You can mail it in. Mail is it takes a little bit longer. So if you want to expedite it, I would venture to say some of the other ways might be a little easier. In person at your nearest VA medical center or clinic. That is always, you can consider that sending somebody there. It's also nice to see where you might be getting your care. So it's almost a way to be able to go in and see where you would be, and then be able to give that right to one of your medical support team at the window or wherever they may be sitting in that clinic. All clinics are kind of set up different. And then they'll send it to their eligibility office at their main medical center. In that instance, you could know within 24 to 48 hours, just a call back to say, hey, I dropped off my form. I was just wanted, call eligibility at that medical center. I wanted to see what the status of my enrollment is. Not only will they be able to tell you what your enrollment is, but they should be able to assist you in telling you what your priority group is, which is kind of an important thing because the priority groups detail who will have a copay and who will not have a copay. Many veterans don't know what their priority group is, and that's just fine. It's not necessarily something they really need to know. However, it does determine who has a copay and who does not. And I see there's something in the Q&A. I'm jumping to it. No, you don't have to do that. However, if you have not articulated that you were in Guam, if there's any change to any type of exposure that you're aware of, if it's something different, and you're diagnosed with something, I would definitely, this is a conversation if you're utilizing VA healthcare, I would definitely have this conversation with your VA primary care doctor. And I should probably say this while I'm talking to you all right now. You heard in the beginning in my introduction that I am the daughter of a Korean War veteran. My father took shrapnel from a hand grenade to his legs. My friends called him Moon Man because he had pieces of his legs that they were like craters. So my friends called him Moon Man. Well, my father used the VA for his care because that was not something that's readily seen in the civilian population. So for my father's service-connected care, he made sure that that was being done at the VA. Nobody is saying you can't use your private insurance if you have it. VA is always an and both. It's not an either or. Being that we are a healthcare system based on eligibility and not an insurance, it's very important to let people know that there are ways to utilize both. My husband is an OEF, OIF veteran. He uses VA and VA only. And like it said, I've navigated the system for decades. I've worked here for 7. I'm a firm believer and the exceptional care that VA has to offer because I've actually witnessed it with my own eyes. So giving somebody the ability to know that they have a choice, they can use both, they don't have to pick an either or, is the best of both worlds. Although I will articulate that having an open line of communication with your VA primary care doctor and anything that you're doing on the outside is critically important to your continuity of care. So again, I just wanted to let you know that it is very important to let people know that they have that option. Next slide, please. VA does afford the best and most affordable health care for its veterans in America. VA can save a lot of out-of-pocket medical expense for a veteran. We all know that eyeglasses are very expensive. And for a veteran who maybe does have a copay with the VA and they have to pay a $50 copay for their eye exam, that would be the most out-of-pocket they would spend for the exam, but their glasses would be free. You've heard people talk about hearing aids, that VA, VA and the hearing aids. There's a reason why VA is the most comprehensive provider of prosthetics and sensory aids. And that is because we are taking care of a population who served in the United States military that can see catastrophic loss of limb or has hearing loss or tinnitus based on exposure to very loud noises or being on a flight line. So there are things that could save out-of-pocket medical expense for a veteran, and I think that that is something that should definitely be noted. But veterans enrolled with VA healthcare are proven to have better outcomes. We talk about suicide prevention all the time. 2/3 of veterans who are taking their own lives by suicide have not connected to the VA. So it's very important that we make sure that veterans are making the connection for better health outcomes and for preventative care. VA's beaten non-VA hospitals in quality ratings and patient satisfaction ratings. That is the absolute truth. So we want to make sure that people know that and understand it. We can go to the next slide. We want veterans to connect too, because this is care that you've earned. You've earned this care because of your time in service, and it's our turn to be able to take care of you. So here's the who, what, when, where, and why. Who? All veterans enrolled in VA healthcare. What? This is about toxic exposure screening. So a brief screening will occur. It's a 5 to 10 minute conversation and a document of potential exposures. So we're taking the veteran's word for what they feel they may have been exposed to during their time in service. Every 5 years, we will repeat this toxic exposure screening. Again, we want preventative care. We want to know what's going on. We want to keep track of the care for our veterans. Obviously, seeing your doctor more is going to be very important. At least once a year, we'd like you to be seeing your VA healthcare provider if you're otherwise healthy. If not, the closer you stick to VA, especially for your service-connected disability ratings, is going to be very helpful. It's also going to be less expensive than paying copays with private insurance because anything that is service connected, would it be at no cost to that veteran? Where? At VA medical centers, we're doing our toxic exposure screenings at clinics and through virtual encounters as well. Why? Why should you have a toxic exposure screening? And it's to support the long-term health plan of the veteran, ensuring that we received informed whole health care and connect for follow-up resources. Exposure-informed care is very important. Right now, VA Central Office is working very closely with outside providers to offer instruction and educational information on the importance of exposure-informed care. Exposure-informed care is very important. It's what we study. We have our War-Related Illness and Injury Study Center right here in New Jersey. which is wonderful that it's right here in this state. Veterans can utilize that with the assistance of their VA primary care doctor if there's something going on. If they do research studies, they do some wonderful things, just looking at studying the war-related illness that the veteran may be facing. It's also important to know in VA that we're looking at whole health. Whole health is extremely important. It's not just about what a diagnosis might be. It's about how you live your everyday life with a diagnosis, without a diagnosis, making sure your mind, body, soul, and spirit are all connected, and the nutrition and the things you put in your body. So if you know a veteran, are a veteran that is utilizing VA healthcare, you can talk to your primary care about a consult with Whole Health. Wonderful, wonderful program in VA. Can you switch to the next slide, please? Next slide.
Yes, I'm sorry. Every time
Oh, it's okay. I'm sorry.
Move my cursor,
It's okay.
I'm on the wrong screen.
That's all right. So here are some of the new 20+ presumptive illnesses based on toxic exposure. And as you see, there's only been a couple that have been added for our Vietnam veterans, but most importantly, hypertension. Hypertension for our Vietnam veterans, that was something that in the past had they got denials. And many of our veterans who have since passed, it's very important their widow or widower is educated on the fact that they are able to then file a claim for their veteran and maybe potentially be eligible for death indemnity compensation if the veteran passed from something that could have been correlated to that hypertension. If the veteran is still with us and they go back to file that claim, now that this is presumptive, it is more likely than not that the veteran is going to be approved with a service-connected disability rating for that. We've had veterans that have also then received some checks, for lack of a better term, of back disability because they had been denied previously and have now been approved. But you can see for our Gulf War and post 9/11 veterans, the amount of presumptive illnesses that have come to light since PACT Act. And these are scary. These are scary diagnoses. So having this toxic exposure screening, and again, preventative, being in front of it, not behind it. We want to be there before there's a diagnosis, not after something potentially could come about. We really want to make sure that we're caring for our veterans as soon as possible, as soon as they have that deployment and they can connect, or as soon as they're transitioning out of the military, retirement, or however they're coming out, that we're connecting them to VA healthcare as soon as possible. Next slide, please. Okay, so filing a claim. This is not my forte. I'm going to be completely honest with you. I am VHA. But I would encourage everybody to go to the va.gov website /PACT. We may have VSOs that are on this call that are taking the trainings if they're accredited with VBA. I know they just did their annual big training. But filling out a 21526EZ, that is an intent to file that holds your place for a year. If you file the claim and the claim takes a longer amount of time, it will go back to that date if you do that intent to file. So you have a year then to actually submit the claim. So in this realm, I would say to talk to an accredited veteran service officer or colleagues at the VBA for filing a claim for service-connected disability rating, for death indemnity compensation, for survivor's pension, for anything. Our accredited veteran service officers are trained and credentialed by the Veterans Benefits Administration. So please, if you know somebody who needs to file the claim, please reach out. Next slide, please. How can you learn more about PACT Act? Very easy, va.gov /PACT. Or like I said, as soon as you go on the va.gov website, it's going to pop up a little banner that says, how does PACT Act affect me? So I would encourage everyone to go to that. How to apply for VA healthcare, we touched on that. You can do it online or several other ways. Filing that claim for disability, that 21526EZ, definitely put in a intent to file and hold that place. Burn pit registry, that we get a lot of questions about burn pit registry. And when you do your toxic exposure screening, you have that conversation. They're all conversational. That first screening may lead to a secondary screening. It may lead to more testing. That all will be then determined with your VA primary care provider. But connecting with the burn pit registry is also very important because it puts your name in the registry, and it also says where you were and what you could have been exposed to. However, no one's uploading their medical documentation to the registry, and that's where having that VA primary care provider is very important, making sure that we keep all of your records and we keep that preventative care going. We also, you're welcome to utilize this slideshow to help educate other veterans. This is for community stakeholders and veterans, and that's all I have for you. So I'm ready to take on as many questions as you would like to give me. What if you wait beyond a year to file? Well, it's just not going to hold your date. It's fine. It's not going to hold your date, though, from your intent to file. You can still file. That's not going to be a problem, but it's going to, whatever date you file, that's when it's going to go back to. I hope that answers your question. Does anybody else have any other questions that you'd like to add? Because that's the only question that I see at the moment. The real important thing to remember is since the expansion on March 5th, it has really changed and opened to people who were previously enrolled in Priority Group 8G and not eligible to utilize VA healthcare services based on income. Now, if they've had a toxic exposure, a TERA, if they were in one of those locations that previously was not recognized, that is now, we really need those people to try again. I will apologize for VA as a whole, because for many years, and I've had veterans say this to me, and it's very sad, and I can't apologize enough. It's articulated that I went to enroll and they told me I make too much money. And it wasn't then explained what that actually meant or why there was a monetary value attached to somebody's time in service. And it all goes back to the minimum eligibility duty requirement. If we can go really far back in time and know why the VA healthcare was even established, and it was built to care for those who had borne the battle. And I could go through the whole phrase, but it's the famous Abraham Lincoln saying that VA stands by to this day. But it meant veterans coming back from battle injured, built a healthcare system. The monetary income is based on there may have been veterans who weren't eligible to afford their own health care, but because they served their country and they met that minimum eligibility duty requirement, because they couldn't afford their own health insurance based on the national income threshold, VA opened the door to care for those veterans. But if their income changed, and the only way I can really explain that is say somebody sold a home or they came into some kind of monetary value that pushed them, that exceeded that threshold, then they wouldn't be eligible for VA again unless they had the service-connected disability rating. The service-connected disability rating will supersede monetary income and time in service. So that is critically important to remember. I will also say this. The other thing that, we hear a lot, especially in outreach, being the people that are out, maybe engaging with a veteran for the first time, maybe the first VA employee to ever speak with a veteran. They've just not done it for whatever reason. But one of the main reasons is I want to leave it for somebody else. I'm not that bad. Please let somebody else have it. And that is not how the VA works. So explaining to a veteran that is very noble to have that mindset. And that's, you're trained to care for others. That's what you do in the military. You're protecting, you're serving, you're caring for others. But the VA works a little differently. So for every veteran that is utilizing VA services, the more services we see. That's why you see the community-based outpatient clinics or VA clinics being built in more rural locations. There's enough veterans utilizing the care that some of them are busting at the seams. So VA is expanding them and making them larger, or putting them in places where veterans may not have had that access before. So by utilizing VA services, technically you could be bringing services to someone who might need it more than you, or the person that you're speaking with, the veteran that you're talking to. So I just want to make sure that that is also very clear, that, VA is there. What if you wait? Oh, wait, that's the same one. Hold on. The Q&A still has the same question in it.
Right there in the chat, though, Jackie, there had been a question about
Oh.
if you've applied for one of these newly newly presumptive conditions, but were denied in the past, is the process to start over again at this point, or a whole new claim, or does it refer back to the original request?
Say that one more time.
The question, and I don't actually see the question.
I don't either. That's what I'm looking for.
Person might have withdrawn it. Maybe they felt that they'd heard what they needed. But
okay.
if you've applied for healthcare on the basis of a condition and it was denied, but now that condition is one of these newly presumptive ones, do you do a whole new claim, or does it
so
somehow?
Perfect. Let's separate that. That's a great question. So let's separate this. Let's remember the VA is one giant umbrella, and under that umbrella you have the three separate administrations: Veterans Health Administration, VHA, that's me; VBA, Veterans Benefits Administration, obviously that's going to be the area in which you're going to be sending the claims to, and then of course National Cemetery kind of speaks for itself. So people get VHA and VBA kind of blended. And as well, we should be in certain aspects. For some veterans, it's the service-connected disability rating that opens the door to VA healthcare. But in this case with PACT Act, or if you filed a claim for something that wasn't presumptive, but it is now, go see an accredited veteran service officer, because you want to get that back filed with the VBA. You may have been denied before, it's presumptive now. You make sure you go talk to an accredited service officer and file that claim. I'm not sure how they do it, if they do it as a supplemental claim, if they do it as, it depends, there's like a timeline that goes with it. Again, I'm not the VBA expert here, but definitely talk to an accredited veteran service officer or my colleagues at the VBA to get further information on that, because you definitely want to file again. And if you enrolled for VA healthcare, which is totally separate, if you enrolled for VA healthcare and were denied before, but this is now, you have a presumptive illness, when that service-connected disability rating comes through, that's going to change the game on the healthcare. So currently, I will tell you that my colleague and I at VISN 4 are working very actively with VBA throughout VISN 4, because historically, DOD shares so much information. So we don't really know what veterans are transitioning or getting out of the military. There's no like magic list that says, veteran Joanne Smith is leaving the military on this date, and somebody should contact her about getting involved in VA healthcare or filing a claim. So the transition process, the TAP process, and enrolling for VA healthcare is strictly voluntary. So we want to make sure that these kind of things are articulated. I recently went to the JRAD event, and I will tell you, honestly, no lie, I must have talked to 5 veterans that were 100% service connected and not utilizing the VA, and paying a lot of money out of pocket for prescriptions, paying a lot of money out of pocket for copays. They never connected to VA. And in all 5 of those veterans, I can safely tell you, 2 of them told me they thought they were saving it for someone else. So the message, that is not completely clear, I think, on how VA works, or that the fact that, you know, if you're 100%, if you're 40%, if you're any percent service connected and eligible to use VA, you're not going to have a copayment for that care. You're not going to pay for medications for that care. You're not going to pay for a surgery for that care. However, a veteran that is at 50% service connected will also not pay for medical care or medications for things that are not service connected. So there's a lot of things where that service connected disability rating that is received by VBA literally affects how the healthcare works on the opposite side. So we're working very closely to try and coordinate to find out who those veterans are that may have never connected to VA healthcare. They may be in need of a toxic exposure screening. They may have had an exposure during time in service, and we want to get to them sooner than later. So that's where you all come in. This is your forte. You are the veteran or you're talking to the veteran. So helping us help you to be better advocates and have a deep understanding of how all this works in PACT Act is so important. We need you to help us. We can't be everywhere, but all of us can be somewhere. So I appreciate everything that you guys do. Is there any more questions in the chat here? The various list of links on the slides, they're not live to you. I don't know who posted that. I see that. However, if you go on the va.gov website, everything is right there for you. Literally, click on that link. What does the PACT Act mean for me? Or for my time in service? Shoot, I am trying to look at it right this second so I can tell you the exact verbiage. I don't know if y'all have access to a computer. Well, obviously you're on it, but ability to go on va.gov with me. Let's see. So, learn what the PACT Act means for you. That's the verbiage. The second you click on that link, it's going to take you to the PACT Act and your benefits. It'll show you where to file a disability claim online or apply for health care. It's going to give you all these little drop downs of what's on the page. What does it mean to have a presumptive condition for toxic exposure? It goes through the whole expansion of PACT Act. And then it lists Gulf War era post 9/11 eligibilities, Vietnam veteran eligibilities. And you can, like I said, click on each one of the little plus boxes and you can see in more depth what the question is. So what burn pit and other toxic exposure conditions are now presumptive? And it will list every single one of them. So I know that that was one of the questions as well. Reading the website sometimes, I will say there are some things that might be misinterpreted. And in that case, I would encourage any one of you to call me. I'd be happy to sit and talk with you if you have a question. Even if you're working with a veteran and you have a veteran there and you have a question, I have service officers that call me regularly when they have a question or a concern. And I'm very happy. It's my work cell phone number. I'm going to drop in the chat if you don't all already have it. And again, you're welcome to call it anytime. And if there's no other, oh gosh, I see questions, but I can't see the questions, Hank. I don't understand what's happening.
Uh-oh. But well, in the Q&A, we've got Paula's put another one. Can you discuss exposures stateside at various bases? So I'm not exactly sure.
Oh, can you discuss exposure stateside at various bases? Thank you for the question, Paula. Here's how much I can discuss with you. So right now we're looking at exposure based on job, based on MOS, based on what happened during a deployment, based on what happened during, your active duty time in service and when you transition out. What VA is presuming and what you're talking about, other than Camp Lejeune, is what I'm thinking. So VA put out a press release. I'm not sure if you saw it, and I will make sure I grab it and I will forward it so you make sure you all have it. It's basically there are talking about different locations like Fort Detrick was one of the big ones during a multitude of different timeframes about potential exposures at stateside military installations. It's not happening yet that I'm aware of. This was proposed, but this is not part of PACT Act. But those exposures, again, are very important. So if you were at a stateside base that eventually is recognized as Camp Lejeune has been recognized, it's very important that that is documented as to one of your locations. If any of these presumptive illnesses that maybe somebody is diagnosed with, it comes to light that there was something like the water at Camp Lejeune. As you know, PACT Act opens the ability to file a federal lawsuit against file a lawsuit against the federal government for now families that lived on Camp Lejeune and those that worked at Camp Lejeune. Again, it's the change. It's one day that's not there and the next day it is. So staying close to VA, making sure you have that outreach person, that advocate, your contacts at the VA to stay close with when you see these things pop up in the news and stuff like that, that you're being kept on top of what's happening with VA and any changes that have been made. But that's all I can discuss with you about exposures stateside. We're really looking at those people who are not deployed, that have the active duty time in service, maybe were at McGuire the entire time they served, but yet they were refueling jets. They were working with diesel fuel. They were a chemical weapons specialist. That's been another thing. A chemical weapons specialist in the Guard, but didn't have 24 months consecutive active duty service. So that VBA service-connected disability rating is going to be highly beneficial to that service member or veteran, because right now the toxic exposure is not going to get them connected to VA healthcare because they don't have that 24 months. So there's just a lot to go with it. And I feel in my heart of hearts, there will be more to come. So we want to make sure that we keep you guys on top of the situation. Oh, you're welcome for the insight. I'm glad you appreciated that. And again, I did type my information in the chat. So for anybody that didn't see it, make sure you write my phone number down, put my name in there. Just call me Jackie. You don't have to call me Jacqueline. It's too many syllables. I don't know why my mother did that to me. I'm not that smart. But please, by all means, please reach out if you have a question or concern. And thank you so much again for your time.
Jackie, thank you very much for everything you've shared with us this afternoon. It's as you said, it's there are enough parts and pieces to this, and it causes people to interact with VA in ways maybe they haven't in the past, and it's always helpful to have the explanation patiently and thoroughly delivered. So we really appreciate your time. Our next quarterly meeting will be in military history topics, and it will be on July 19th. That's our summer quarterly. And then also for those who follow DVVC, our annual planning meeting will be in the fall this year. It will be on October 11th. And that's at that meeting, we set the future direction of DVVC and count on our volunteers from our member organizations to help us plan what we'll be doing in the coming year. That meeting is a hybrid meeting. Both you can participate either through Zoom or in person here on the St. Joseph's University campus, and so you could just mark your calendars, hold the date for that. Thank you all for your participation, and Jackie, thank you again, and have a memorable and meaningful Memorial Day weekend.